Thank you for joining me today. We're going to continue our educational video series, and today we're going to talk about comparing fertility care centers from an apples to apples perspective, and especially digging down deep into package offerings and pricing, because while you think fertility treatment can't vary that much, there are differences in the protocols used. There's differences definitely not only in the bottom line price, but in what you get for that price. Just a brief history on myself. My wife and I are former patients that have gone through infertility, gone through IVF. We really do understand the struggles and the difficulties that go on when you're battling that infertility journey and going down that rough road. There's so much involved, and making that commitment to not only see a specialist but to proceed further with care and treatment is a first big step. But there's multiple steps beyond that that are very big, including the financial aspect. Everybody wants to find a way to save money, get through the treatment, get the best care of treatment, but also with spending the least amount of money. And then knowing the emotional side of things. And so I want to take this moment to help give some perspective and give some options for you to look at to help you be better educated going through the process as you do go from center to center, or physician to physician, and try to help you find the right solution that's beneficial to you and in your circumstances. And when everything is so emotional and everything is overwhelming, sometimes you miss just one little thing and it can make a big difference. So just helping you out in this way, I personally hope that I'm able to assist you, and so is MCRM. No matter what your decision is, this information hopefully will be extremely helpful to you, and we'll go forward from there. We did do an earlier video series. You can visit it at youtube.com/mcrmfertility, talking about ways to save. There's ways to save on medication, there's discount options, there's grants out there. So I really encourage you to check that out. We'll also give you a link towards the end of this presentation that discusses that even further. All right, let's compare apples to apples and oranges to oranges, but not apples to oranges. We're going to take a look at things that maybe you should consider when you're comparing individual fertility centers. We're lucky in this region to have multiple centers available to assist patients, and each center has its own uniqueness. And if there was just one center for everybody, obviously no one else would be around. So we encourage you to go ahead and find the right center that you feel comfortable with, number one. Number two, that fits your needs. And so this is going to help guide you a little bit, maybe some questions that you can ask, and just to help you be a more informed consumer as you go through the infertility journey. Again, my name is Dale Bader. I am the marketing director with MCRM Fertility. I'm also a former IVF patient, and I really wish I had a lot of this information, and my wife too, when we went through things about 10 years ago. There's a lot out there that you can read, you can listen to. A lot of it is from former patients. A lot of it is from people who have tiptoed in. But everything you see, you read, you hear, really take it very carefully, because everybody is unique. You and your partner, you're in a unique situation. You have unique circumstances that relate to you and you alone. And while someone that you're talking to may be going through infertility, in the big picture, we share a lot of the similarities. But when you get right down to the individuality and the simple part of the protocol, things are going to be different. Processes are going to be different because they're designed to meet the optimum level of success for your individual circumstance. So simply comparing Jane Doe and her process with Lee Allen's process, you really can't directly do that. You can get some ideas, you can get some thoughts, But you got to really be understanding that everybody is unique. And if the process is done properly, you're going to be provided with a personalized treatment and process that is specifically designed to meet your individual needs. And we also know that there's a lot out there, from news media, magazines, social media, discussion boards, that individuals are going to share. And my wife and I are big proponents. Open up and discuss your circumstances. We support that very highly. And so does MCRM. But while doing so, just understand that some of the stuff you may see and read is probably just the tip of an iceberg. It's such an emotional process to go through infertility. And you're most likely to share the very goods and the very bads. And there's usually this in between that is kind of left out because it doesn't seem as maybe romantic or as interesting, but it really creates the big picture, the complete picture. And so you got to make sure you keep that in the back of your mind. If you ever have questions, don't hesitate to ask your fertility care center or centers or physicians. We know you're going to look at multiple options out there. You got to. You need to find the right place for you. This is a big step in your life. Not only working towards becoming a parent, but there's a lot of emotion involved. There's a lot of financial risk involved. And so you want to go where you feel the most comfortable. But you also should make sure you have your questions answered. Just because you sit down and you ask a bunch of questions at your consultation, you're going to hear information. It's going to take time to drip on you. You're going to come up with more questions. And you should feel very comfortable to be able to get those questions asked without necessarily always having to come back to the doctor's office. We're very open. Dr. Allering, Dr. Aubuchon, our two physicians, you can simply shoot them an email and they will respond to you trying to help clarify those questions. It's best to get direct information from the physicians and the centers. I know you're going to go out there and you're probably going to ask questions. Hey, Jane, what did you do in this circumstance? But remember, again, you're unique. Your situation's unique. And so you really need to get the answer directly for your circumstance. There are two really significant advanced fertility treatments that most patients are going to utilize. And it's either going to be intrauterine insemination, IUI, or it's going to be in vitro fertilization, IVF. And there's some variations of both as you go through the process. IUI, from place to place, can be totally different. And it's basically on protocols and beliefs that the physicians have. Some OB offices, obstetrics offices, will perform IUIs in their offices. Some do not. And where you go, some OB offices might utilize one protocol of medication only. Some may use a couple of different variations. And the same thing as you go to fertility care centers. Medication protocols are going to be utilized differently. And again, a large part of that is the personalization for your particular case, number one. And number two, the belief of the physician as to what they believe will provide the highest optimum level of success in your circumstance. Obviously, the number one goal is for you to walk away with a healthy baby after your treatment in about 9 months. And it's finding the way to get that pregnancy, a healthy one, as quickly as possible so that you get to that ultimate goal of having that beautiful baby down the road. Medication protocols, it's very often that it's simply for an IUI going to utilize Clomid only. And that might work in some cases, but that might not necessarily be the optimum situation for you. Maybe there needs to be an additive medication, such as letrozole or gonadotropins, which some of those may look familiar if you've ever done IVF, because some of the medications are similar to IVF, and they're designed to help provide the optimum number of follicles so that you have the right amount of high level success of becoming pregnant. Who oversees the process? Do you have constant interaction with a physician throughout the process? Is most of the process oversight by a nurse or a nurse practitioner? Um, those are some of the things that maybe a question that you would like to ask. What's included in the pricing? Um, you know, how is it structured? Is it a simple one-time price that covers the entire IUI treatment process? Or is there different charges along the way? For example, you're probably going to have a couple visits, maybe one, maybe two, where they're going to do some monitoring, making sure that the medications are working properly, that optimally everything is working the way it should. That's probably going to take office visits, that's going to take ultrasounds. Is that part of a package, or are those individual visits going to be an individual charge? What about the preparation of the sperm? Obviously it takes sperm and egg to make a baby, and there's a process typically called sperm washing that takes place to prepare the sperm for the IUI itself, whether it is a fresh sperm from your partner or whether you're using donor sperm. And then the IUI administration itself. So those are questions that you definitely want to be aware of, to ask, and it may be the physician that can help answer those. It may be the financial coordination team that can help that. Moving on to IVF. There are a lot of different beliefs. There are a lot of different thought processes. There's different pricing. There's different services that can be added on. So you really need to make sure you're comparing apples to apples and not apples to oranges. Simply saying, well, I went to Fertility Center A, and I went to Fertility Center B, and I went to Fertility Center C, and I got pricing for a single cycle IVF. And this is what this price was. Well, okay, but what does that include? Because not everybody offers the same services included in the packaging. It's what that center believes is important and is required, and sometimes they don't want to offer it generally for all patients, and sometimes there's differences that what's available. There are also multiple cycle plans probably offered. For example, here at MCRM, the hardest question to answer for anybody is, what does it cost to have IVF at MCRM? And I think that same question can be difficult to answer at any fertility center, because A, you again are unique. Your situation is unique. There is both you and your partner, and each of you are unique. Right away, now you have two variables, and it's got to be structured to assist both partners optimally coming together to help create that wonderful joy of a baby. And how are we going to optimize that level of success while doing so in the quickest manner of time and at the lowest possible cost? So, for example, at MCRM, we offer a multitude of different plans designed to go from different cost structures to different options overall. If you have diminished ovarian reserve, for example, and maybe your partner has significant male factor, well, maybe single cycle IVF won't provide the highest likelihood of success. Maybe optimally committing to 2 cycles up front is what's going to lead to the highest level of success at the lowest possible cost. But that doesn't necessarily mean you have to do a 2-cycle banking. If you don't feel comfortable with that, then you can say, I just don't feel comfortable doing 2 cycles right off the bat. Can I only do 1? And I can guarantee you the physicians are going to say, you can do what you want to do. Absolutely. You are your own boss. But they'll explain too why they've again optimally thought that the other option is best. But you have to do what works for you, whether it is 1 cycle, whether it is multi-cycle, whether it's an assured fund. Again, protocols are going to vary from center to center, because every physician has their different beliefs as to what is the best protocol of medication based on your circumstances to work. Um, there's different beliefs. There's mini IVF or micro IVF out there. There's standardized IVF. There's using PGS. There's enhanced sperm screening. There's all kinds of different beliefs that physicians take to get where they believe is going to provide you that highest level of success. Another very important part, and I think this goes way overlooked too often, is looking at the lab. Now, often you can't actually view into the lab because the lab is a very clean environment, or should be. We have a certified clean lab at MCRM, and that is to provide the highest level of air quality so that successful embryo development is achieved to provide that higher level of success down the road. Look at the lab director. Number one, is the lab director on site? There are certain cases where the lab director is a contracted lab director. He oversees multiple labs across a region or maybe even across the country. Maybe that lab director only comes in on occasion and just double checks the lab. Has embryologists that work there at the lab, but he's not there himself. There are different qualifications for lab director. Some are simply just an embryologist. Others are PhDs. Others are PhDs with HCLD, which stands for High Complexity Lab Director. And it takes a lot to get that certification, and it does mean a lot. So those are questions you can simply ask during your consultation, or you can always come back and ask and say, hey, can you give me a little more information regarding your lab? Because it is very important. It plays a very important and critical role in your treatment. IVF prices, again, I say that's the hardest question to answer up front without speaking to the patient. Dr. Aller and Dr. Aubuchon will tell you that straight up because of the total uniqueness. No two couples, no two individuals are identical and have exactly the same situation. But generally, costs for IVF, and this is looking across the spectrum across the United States, can run as low as $3,500 for one cycle to as much as $20,000 or possibly even more for one cycle. This is the treatment process alone. This is not including medications. So what are you getting for that money? And you really got to be careful about the extras. Just because maybe it's at $3,500, is that giving you exactly what you need, or are you going to have to add this item, that item, this item, and that item, and all of a sudden now you're at $10,000? So you got to really look at that. And one thing I really want to stress is don't look for just the bottom dollar. I did that as a patient. I was very financially conscious, and I always wanted to look, well, what is the cheapest? But it's not necessarily what is the cheapest, but what is the highest value? I kind of, maybe this is a male perspective, but, high-end, beautiful 60-inch new Super HD TV, if you saw that for $150, and yet you saw a Samsung at the same store for about $650, you're probably tempted to say, ooh, I want to go only for $150. And maybe you buy that $150 TV, but don't realize it's only got a 30-day warranty, and after 35 days, it goes out on you. Now you got to buy another one. You decide to buy the same one. Can't happen again. And at 40 days, it goes out. So now you got to go buy your third TV in just a few months. You spent $300. Now the question is, do you feel comfortable buying yet a third at $150? Or are you going to buy a higher quality and get past it? And now all of a sudden you've spent $300 that is extra. So now your TV is going to cost you, instead of $600 up front, $900 in total. So look at the value. Find out, part of that is The ultimate end game is getting you pregnant and having that healthy baby and healthy pregnancy. How many cycles is it going to take to get there? If it's going to take 4 cycles at $3,500, that adds up. Where maybe it's only going to take 2 at 6,000 or 1 at 9,000. And every time you do a cycle, you're also going to have the medications. And those medication costs can be significant. And that's often overlooked, and it has to be kept in the back of your mind. Be sure you know clearly what is and is not included in your package. We strive so hard here at MCRM to make sure that from the very first day you walk into our office, you are provided information about our packages, the pricing, what's included, as well as what are some of the ancillary services and what are their costs. Now, you may not know right then and there what exactly package is best for you and what ancillary items you might need, but at least up front you can start seeing some of the pricing. And once you've had your consult, once they've been able to narrow down a particular treatment plan, whether it's IUI, whether it is a low-end IVF or a multi-cycle IVF, then that can be guided to the financial coordinators, and they can talk to you in more detail about these are the packages that are being recommended, but here are the other packages available. Here's what is being recommended to provide that optimum level of success, and the doctors will have helped explain that as well. But you need to know, are your ultrasounds, your monitoring visits, any lab work, anesthesia, your hospital or procedural room fees, medications, again, most cases that's not going to be included, but is it in some cases? ICSI, that's a form of the fertilization process. MC, it's an enhanced version of that. The culturing of embryos, is this going to be cultured out through 3 days? Is it going to be cultured out through 5 or 6 days? All of that varies and changes in prices from center to center. Again, is this going to be fresh or frozen transfer? Does it matter? Are we going to be charged differently if we're doing what's called an embryo banking, where we're coming in, we're getting the eggs retrieved, fertilization, and then we're freezing those to come back for a transfer later? There are some scientific research that explains that taking some time off and coming back for a frozen transfer a month or 2 later is better. Are you doing PGS testing? In that case, you would be needing to do embryo banking. Because you're doing that, does that mean you're going to be charged differently? Endometrial scratching. Is this something that the center offers? Is it something that is included? Embryo glue or a bonding agent for the embryo to successfully bond to your uterine cavity and increase the likelihood of implantation. The cryopreservation or freezing of any embryos that may remain. Storage fees, assisted hatching. These are all things that can be ancillary, could be included, but you need to be sure you know which way is it. How many retrievals are you going to be getting for the package? How many transfers are you getting? Again, mini or micro IVF versus standard. In general, just in a nutshell, mini micro IVF really is the same in the processes as standardized IVF. The difference is the level of medications used. And really that is where the cost savings in most cases comes from. Now, certain centers, they may say, oh, you're doing micro IVF, we're going to lower the cost of that treatment, plus you're going to save on the medications. But it's our belief at MCRM strongly that, in most cases, those lower dose medication protocols are going to provide a lower level of success. And so you may have to do the micro or mini IVF 2 times versus 1 standardized IVF. And so as a result, that's why the cost is lowered, because they know they're going to have to do multiple cycles to try to help offset that. So keep that in mind when looking at that as well. Is the package an assured plan? Does it provide any type of guarantees? What happens if you don't become pregnant? Do you get any money back? Third-party reproduction fees. Do you need a donor? Do you need a surrogate? Do you need both? Sometimes there are special additional fees for that because there is some additional paperwork and additional time that the staff has to take to really help get everybody and all the different parties together to make the process work. So there's more that goes on behind the scenes that many patients don't realize. But as a result, the clinics sometimes have to recoup some of that time, and there is some increased costs. If you have the benefit of having insurance coverage, what part of the coverage is covered? Sometimes insurance will cover the treatment, but maybe not the cryopreservation, maybe not the PGS testing. So while you do have coverage, maybe not everything that you think you should be getting covered is covered. And also, you need to know, is the fertility center I'm working with, will they be billing the insurance? Or are you going to have to pay up front and then have the center provide you the information so you go back to your insurance to get repaid? Obviously, that's a lot more difficult. You're still going to get coverage, but you have to cover the costs up front first. And when does your IVF treatment package begin? Does it begin going retroactively back to your consultation? Or does it begin some other time in the process? For example, baseline, or does it take place the day of your egg retrieval? Those are all things you need to know. And pay very close attention to when you're being presented the financial pricing or financial contracts and agreements. Are there special services available that are simply not available elsewhere or are unique? For example, here at MCRM, in the region, we are the only ones that offer an embryo scope that you can utilize. We also are the only ones that have nanobead sperm selection. It's a specialized pioneered technique that we use here at MCRM to help select the very best sperm to help increase the likelihood of a normal embryo. When you have abnormal embryos, you have a high incidence of miscarriage. So we would definitely want to reduce the level of abnormal embryos and do what we can to increase the likelihood of getting a normal embryo. The video you see here, that is the process being in motion. There's a selection of beads there in the middle of the screen. You see some of the sperm that are attached to that. That is going to deselect the bad sperm, and only the good sperm will move on beyond that. And then we'll take it on to ICSI and MC and continue the fertilization process. PGS testing, pre-genetic screening. Is this something that is recommended for you? Where is this testing being performed at? The laboratory. I can guarantee in most circumstances it's not your IVF center. They're going to do what's called an embryo biopsy. Some cells are going to be taken off the embryo. They're going to be cryopreserved and they're going to be sent out to another laboratory, a genetic specialty laboratory, that's going to look at those cells and do the testing there. What laboratory is that? And what type of test is going to be performed? There's different varieties of PGS testing, from array CGH to newer variations of next generation sequencing. And there is differences. And you can visit the MCRM Fertility website for some more information that really outlines the differences between ACGH versus NGS. Then what is the pricing structure? And what's the cost of the PGS testing? Semen analysis. As you go through the process, it's highly advised that the partner has had a semen analysis to look at what type of, if any, male factor there is. Not all semen analysis is created equal. In some cases, it's actually a human looking at the sample under a microscope performing the analysis statistics. In other cases, it's a slide going into a computer and a computer taking care of that. And the computer can't always decipher properly what is truly a sperm cell and not, what's dead cells, what's truly a good cell, what's what we call debris. Does that semen analysis have morphology? Morphology is very important in getting a better look at quality. And even better yet is DNA fragmentation. Does your center offer that? In most cases, if they do, it's going to be the sample is going to have to be shipped out for that testing. Is it provided locally, on site? Those are questions to ask as well. And again, is any of that testing included in your package? OB ultrasounds. Once you've had the treatment and you've become pregnant, are the monitoring of obstetric ultrasounds for the next several weeks included, or is that separate? Most centers are going to monitor you for pregnancy through 8 to 12 weeks to see how that pregnancy is continuing before they release you back to your obstetrician. Any lab work, blood work, is that included, or is that being billed to you or your insurance? And again, medications. Medications are a big thing. You will see a treatment price, and it's not to hide behind anything, but the treatment price is typically the services offered by the fertility care center itself. They may highlight some of the ancillary charges that you may need, like hospital charges. If you're working with a center that does the actual treatment at a hospital where the retrieval and stuff is, then you may be charged hospital fees. And the same thing with medications. In most cases, medications have to be obtained at a pharmacy. You're going to be charged by the pharmacy or wherever you're buying that medication. And so you need to have an idea of what that is. And if you do get some medications included, you need to be aware of that, and congratulations. So let's take a quick look at a comparison. And I want to use what we're utilizing as our standard protocol at MCRM. This is called our Gold IVF package. It is a single cycle IVF package. Basically, it's an embryo banking single cycle package with pre-genetic screening utilizing next generation sequencing. Since we have adopted this protocol earlier in 2016, we are seeing 75% pregnancy rates, and that's tremendous. So when we provide this as a recommended protocol, if you go and compare that at another center, you may say, okay, well, there's $4,000 or $5,000 difference in price. But did you look, is it PGS included? Is some of the extra ancillary services included as well? So let's take a look, for example, at this one particular package. And again, as in most centers, MCRM offers a multitude of different plans that hopefully one plan will fit not only your situation, but also your particular financial need. So in this case, monitoring visits and ultrasounds are included. Procedural room fee and supplies is included. The process of ICSI is included. We also include what's called IMSI, and I'll talk a little bit about that. Embryo culture is included. That's all the way out through day 6. Assisted hatching, the embryo biopsy process, the cryopreservation or freezing of any remaining embryos, also the embryos for later use in the frozen embryo transfer, the preparation and thawing of the embryos when the frozen embryo transfer comes, the frozen embryo transfer itself is included, and the required monitoring blood work that is completed at MCRM. That's what the asterisk stands for. We have the ability to do some of the blood work here in-house. Anything that we are not able to perform in-house goes to an outside blood lab, and they will bill the insurance or self-bill the client. We outline specifically the different blood work that will be provided in your particular package. So you will see that in your contract. On the left-hand side here, these are special additives that we include in our package that are typical extras that we find all across the country, but we include it separately. We include morphologically selected injections. So not just ICSI, but we take it to a much higher resolution of examining that sperm cell before we inject it, so we get the highest quality. And that is after we follow up with sperm nanobead selection process. So we include that. We included the culture through day 6. We do the endometrial scratching, which helps prepare the uterus for the transfer of the embryo. We include the embryo glue to enhance the level of success of getting an implantation. And we provide in the pricing structure the PGS testing, but that PGS testing does go out to the performing lab that does the test, but we show that price straight up front for you, and we give you an estimated cost of the medication. This entire package, without the medications, is priced at $13,750. Now, in general, the going price for a single cycle IVF, that's not an embryo banking cycle, across the United States averages about $12,500. That's the price. That doesn't always include all the different options. That's just the price for a single cycle IVF. And again, then you go into the details of what's included. We've done some research across the region, and we've looked at some different centers just to kind of give you an idea. Another center offering single cycle IVF with the transfer is simply $12,200. Again, that's very close to that national average. When you have to add in the PGS and biopsy, you're looking at an additional $4,000, giving you a total of $16,200. That's pretty close to being a true apples to apples comparison. At another center, the single cycle IVF with the transfer is $13,850. But they don't offer the assisted hatching, so we have to add that in. We'll add the PGS and the biopsy. That's another $4,600 or a little bit more. And you're looking closer at about $18,475 for the total cost. Again, this is more of a true apples to apples, but some of that was highlighted in red on the previous screen that I showed you, again, that MC and sperm nanobead and stuff, that is stuff that more than likely is not included. There's extras that MCRM is able to offer. What I'm really trying to compare truly is that left-hand part of the screen, and then just remembering the extras are also included there. So as we go on to looking at a couple more centers, another center, their single cycle IVF with transfer is $12,150. Again, right in that ballpark of that national average. But when you add PGS and biopsy, you're adding $6,500 additional. So now all of a sudden you're looking at closer to $18,650. And again, that is still without medications added. And at the last center we looked at, just the start for a single cycle IVF with a transfer is $14,600. So right there in that, it's a lot. It's getting closer to some of the prices that even A and B were just above that. And then when you add ICSI, assisted hatching, the PGS, all which was not included in that other price, now you're over $19,000. And now we got to add some of the extras possibly still in there. For example, anesthesia. Most cases, centers work with a third party for anesthesia. That third party is who's going to bill you for that anesthesia. That charge is usually an additional $400 to $600. So that's got to still be added in there. Any additional ancillary services that may be recommended, you got to add those in. And you're going to have to add that medications. And the medication average cost for one single cycle of IVF is generally in the ballpark of $3,000 to $5,000. So now you can kind of start to truly see a true total cost of a true apples to apples comparison. But again, maybe you're willing to pay more because you feel the value is there. And that's what you got to truly look at. Where do you feel comfortable? Where do you think you're going to get the highest level of success with the least amount of inconvenience to you and your body? And at that point, the value of cost that you're willing to go for. And all of that hopefully really helps you as you move along the process and helps spur questions to ask not only the physicians but the financial coordinators at the different centers that you might look at. So again, always look at value. Don't be hesitant to ask the questions, and always get the questions answered by those centers themselves. Not to say you can't ask questions on discussion boards or social media or over the phone with your friends, but use that information as little nuggets in the background, but always get a true clear picture and understanding from the center themselves. And always be sure to read your financial contracts, because the centers are trying to provide the information so that you're well informed as to what you're truly getting and what is going to be the true cost in the end game. No center wants to just surprise you with costs that you were not aware of. They're going to be upfront with that. You just need to be sure you're reading over and looking at everything as well. And just be sure you're an informed and cautious buyer as you go through the process. Ultimately, we want that end game to be the same goal as you, a healthy pregnancy that leads to a wonderful live birth of your baby. And again, as mentioned at the beginning of this video, if you're interested in learning more on how to save for infertility treatment, and especially on medications, grants, there's a wonderful URL, or simply visit youtube.com/mcmfertility. It's our YouTube channel, and the video is available there. And if at any point I can help you, if you have a question or if I can help guide you in a direction, I'm more than happy to do so. Simply email me. There's my email on the screen. It's been a pleasure. Thank you for taking the time. And if you know somebody that this information is helpful for, please be sure to share it with them. And we look forward to assisting you along your journey. Have a wonderful day.